Hi, in this video we'd like to talk about adenomyosis, which is also a form of endometriosis. So adenomyosis is also the displacement of this endometrial tissue, which means it's growing in places where it's not supposed to grow. But for adenomyosis, there's a very specific place that it's found to be growing. It's been found to be growing inside the myometrium, which is the uterine muscle walls. These tissues embed themselves deep inside the uterine muscle walls, but they also carry the property of shedding monthly, bleeding monthly, which is why they will cause bleeding within the uterine muscle walls and also harden, causing lesions. These bloods will either leak out into the pelvic cavity, causing accumulation inside the pelvic cavity, and all of these will cause one of the most extreme menses pains. So if you have friends who are bedridden during menses, 1 to 2 days, unable to function, carry out their daily activities, most likely they have a form of adenomyosis with maybe a much more severe form of adenomyosis, and they need to get checked. So diagnosis for this type of condition is done using ultrasound, 4D color Doppler ultrasound, and also hysteroscopy. This type of adenomyosis patient will have a much more enlarged and solidified uterus because of the presence of these lesions within the uterine muscle walls, so it's very easy to spot one. They will be much more large, and it's also kind of swollen because of the presence of these lesions. So treatment here at Antai Hospital is that we will do surgery for this. Very similar to endometriosis is that we need to pinpoint the locations of these lesions using 3D laparoscopy and also, if need, hysteroscopy to one by one remove them, all of these lesions. Upon recovery, patient will notice that she will have menstruate regularly again. She will be able to get pregnant naturally. She don't even need to go for IVF or IUI. And she's able to sustain them to full-term healthy pregnancies, and she will no longer suffer these very painful menses pains. If you have menses pains, it means there's something that's causing it. It's not normal to have menses pains, especially severe ones such as adenomyosis. So if you'd like to find out more information about treatment and a diagnosis of adenomyosis, please visit our website and also leave me a comment down below.